Welcome, guys, to Doctors of Medicine. I am yours, Ngonizashi Zimbwa. So today we are going to talk about the lower limb, the anatomy of the lower limb. So we are going to start with the gluteal region today. So as you can see, that's your gluteal region. It is made superiorly by the iliac crest and then inferiorly by the gluteal folds. It comprises of the gluteus maximus, the gluteus medius, and the gluteus minimus. So that highlighted is your gluteus maximus. It originates from the posterior of the ilium, and then it inserts on the three quarters of it. It inserts on the iliotibial tract, which is the thickening of the fascia lata on the thigh laterally. So that is your iliotibial tract, and then that's where three quarters of your gluteus maximus attaches, and that is responsible for knee extension. So if an MCQ question comes and says, what is the function of the action of the gluteus maximus on the knee, you find out that the gluteus maximus is insertions on the knee via the iliotibial tract. The iliotibial tract, it originates superiorly from the iliac tuberosity, and then it inserts on the lateral proximal condyle of the tibia, and this is responsible for the extension of the knee. So the gluteus maximus, three quarters, it attaches on the iliotibial tract, and then we have what you call the gluteal tuberosity. So if you're to look at the anatomy of the femur, you're going to find that there is what you call a linea aspera. So the linea aspera, the lateral lip of the linea aspera, it is going to thicken and form a tuberosity that is called the gluteal tuberosity. Wow, so what does this tuberosity do? Easy. That's where 1/4 of the gluteal maximus attaches. So these fibers that attaches to the gluteal tuberosity, when the gluteal maximus contracts, is going to perform what you call a lateral rotation. So that's your gluteus maximus. So your gluteus maximus is very important in such a way that it is very thick. So it is a muscle for intramuscular injection. All right. So before I get deep into the intramuscular injection, I want you find that cutaneously the gluteal region is going to be divided into 4 quadrants. What? 4 quadrants. So you just draw a plus sign on the gluteal region, and then you're going to divide it into upper lateral quadrant, upper medial quadrant, lower medial quadrant, and lower lateral quadrant. So these quadrants, they are very important because they receive different cutaneous nerves. So let's go. Right. So from the upper lateral quadrant, you're going to have innervate the cutaneous skin. The skin is going to be innervated by the subcostal nerve teeth cuff and the iliohypogastric nerve L1. That's the upper lateral quadrant. The upper medial quadrant is going to be innervated cutaneously by the posterior rami of the first 3 lumbar nerves and first 3 sacral nerve. So whether we say posterior rami of L1 to L3, sacral rami of L1, posterior sacral rami of S1, S3. That's for the upper medial quadrant. We go to the upper lateral quadrant. So if you're going to study what you call the lumbar plexus, we're going to have what you call the lateral cutaneous nerve of the thigh. The lateral cutaneous nerve of the thigh comes from L2 to L3. This one, it goes lateral to the psoas major, this would be the most lateral feature behind the inguinal inguinal ligament, and then it's going to innervate the lateral cutaneous skin, right, on the lateral aspect of your thigh. So that would be your lateral lower quadrant. What about the lateral medial quadrant? So remember, when we're doing the sacral plexus, we spoke of the posterior cutaneous nerve of the thigh. That one. So the posterior cutaneous nerve of the thigh, this comes from anterior rami of S1, S3. These ones, they go and innervate the posterior aspect of the thigh, as well as the popliteal region, as well as the gluteal part, which is the lower medial portion. So that's all.